voices coming from the medical fraternity, where he's always tried to bring in facts, information out in public domain. Your views, Dr. Soin, have been received with rave reviews. People have looked up to listening to you here on India Ahead and other platforms. So let me firstly thank you on this day of National Doctors Day. And let me then ask you, sir, how would you rate the experience of the last 3 months? Would you be satisfied with the how you dealt with the challenges which were there in front of you? Would you say that you were satisfied to deal with them?
So, Bhupen, first of all, thank you very much for those kind words. And those are one of the things that make for the gratification that doctors get out of being what they, being what they are and doing what they do. Being a doctor is a calling. It's not just another job. And the main motivation is to make people healthy and save lives. So that's what we get our thrills out of. If you do a new procedure, or if you save lives, or if you bring a smile on a parent or a brother or a sister's face, that's what we live for. So obviously these barbs and beatings and these seem very unfair. What sort of payback or justice is that for all the hard work that doctors have done, and not just doctors, obviously all healthcare workers and frontline staff. So so once you throw yourself in as a doctor, what I've seen in the second wave is unparalleled. Even as a doctor, having been a doctor for nearly 35 years, I've never seen this kind of spirit. And I think that all the healthcare workers, doctors and nurses, worked shoulder to shoulder, day and night. Nobody was bothered about what was happening at home, whether they went home or not, whether they ate or not. It was, the only motivation was to just do one's duty and save lives, save as many people as you could. And I think that that spirit was even more evident in the second surge compared to the first one, partly because we knew what we were dealing with. Most of us were vaccinated, so emboldened by the fact that we were protected. And many of us, unfortunately, are not here anymore. And when that happens, that unfortunate event happens, then all you want is that your family should be protected, they should be cared for. That's all. Because if you're not around to take care of them, then somebody should take care of them, and that's the government. And in terms of payback for what you do, money, I promise you, is the last thing that 99% doctors think of. When you're actually doing your job, you're doing an operation, you're taking care, you're writing a prescription, that's the last thing you think of. You just think, I've got to make this patient better. That's what I have to do. Before I finish my duty, I hope this one's BP comes up, this one's oxygenation is better. That's what drives you,
Was this the toughest challenge for you, Dr. Soin?
How we all feel.
Yeah, sure. Of course. I often wonder, people ask us this question all the time. How do you deal with, with so many crisis points? And I always say that journalists at the end of the day are also human beings. And, I echo your sentiments. Doctors are also human beings. But would it be fair to say that this, for someone with your experience and caliber, has this been the toughest journey for you in your career as a medical professional?
Well, I have treated hundreds of patients with liver disease and COVID. I don't see general COVID patients, but I think it's been tougher for patients for doctors who've been in the ICU, the intensivists and the ICU doctors, senior and juniors. I think it's been the toughest for them and the nurses who've been taking care of such patients in the ICU. They've been in PPEs throughout. I mean, to be honest, my PPE time in the day would be maybe an hour or two when I do rounds on patients. But there are doctors who've been in PPEs for 8, 10, 12, 14 hours at a go, and nurses. And it's been the toughest for them. And when they get, they've not had a morsel to eat for those 8 to 10 hours, and then they get drained out. And unfortunately, 2 or 3 patients in their care would even die. It's very demoralizing. And on top of that, if you have all these barbs and people, beating up doctors and nurses, then that's really the last straw.
What would your appeal be today, Dr. Soin? The Prime Minister has reached out to the doctors community, and every cabinet minister worth his salt or her salt today has gone on Twitter to thank the doctors. Everybody's thanking the doctors. If the Prime Minister would be watching this show, what would your appeal be to the Prime Minister today?
I think the appeal would be very simple. It'll be that pay back the doctors with smiles and appreciation and a little bit of compensation if they should lose their life. And do not send confusing messages to the public. If you're saying that you're backing science and the treatment and the vaccines are going to be scientifically governed, then let's stick to science. Let's not just go to alternative medicine, especially when there is no scientific proof or trials behind it. I'm not against any other alternative system of medicine. Yoga is very good. But I think other systems, other streams of medicine have very less evidence-based practice.
Well, I was
so
hoping
let's
to
not
be-
confuse
Yeah.
let's not confuse people with that.
I was hoping to be joined by